When a living space becomes completely congested by towering stacks of objects, it stops being a home and becomes an impassable, physically unsafe environment. It is very common for people to look at a room like this and assume it is simply the result of extreme laziness or a chronic lack of cleaning. The person living inside feels the weight of that assumption. They internalize the harsh societal judgment, which builds a deep, isolating shame that actively stops them from reaching out for help. By focusing strictly on the external mess, society completely misses the internal mechanism at work, trapping the sufferer in a silent cycle of embarrassment. Because the danger of the physical environment is so obvious, frustrated loved ones often step in with strict ultimatums, driven by genuine concern for safety. This leads to a familiar intervention: the forced cleanout. Family members rush in with garbage bags, rapidly tossing out years of accumulated items. The problem is that this tactic almost universally fails. Within months, the cleared spaces inevitably fill right back up. You cannot resolve profound psychological distress by simply wiping away its physical symptom. The medical community recognizes this as hoarding disorder. It is a specific clinical condition, entirely distinct from ordinary clutter and OCD. It is driven by two very powerful internal forces. First, the individual feels a highly intense, undeniable need to keep items, even if those objects have zero monetary or practical value. The second force is distress. A massive need to keep heavily outweighs actual value, connected by a tight spring of anxiety. When forced to discard, that spring redlines. The mental mechanism freezes, completely paralyzing the ability to decide. To the brain of someone with hoarding disorder, tossing a valueless old receipt triggers the exact same neurological panic as throwing away a precious family heirloom. And this engine of distress rarely operates in isolation. Hoarding disorder frequently co-occurs with other recognized conditions, specifically generalized anxiety, depression, and ADHD. The executive dysfunction caused by ADHD makes basic categorization incredibly difficult, while the deep, persistent fatigue of depression drains away the minimal energy required to actually organize a room. The hoarding is a complex, intertwined web of mental health challenges that requires a careful, holistic clinical approach to unravel. To treat this effectively, families must drop the ultimatums entirely and replace them with profound compassion and patience. The clinical standard of care relies on specialized cognitive behavioral therapy designed specifically for hoarding, often coordinated with occupational and social supports. This flowchart shows active skills building. Clutter enters the process, moving through a sorting mechanism to build categorization skills. The critical work happens at the decision nodes. Therapists train patients to tolerate emotional distress, shifting their response from red to green to allow discarding. True recovery happens by systematically equipping the brain with the operational skills it lacks, instead of simply emptying a physical room. Because of the nuance involved, accurate diagnosis and this specialized CBT must be administered by a licensed clinician. Coping and Healing Counseling, or CHC, provides exactly this kind of expert, compassionate care. Looking at this map of Georgia, you can see the reach of CHC's digital network. Their model is 100% HIPAA-compliant telehealth, allowing patients across all 159 counties to receive secure help directly from their own homes. Their specialized care is financially accessible too. CHC is in-network with major health plans like Aetna and Blue Cross Blue Shield, and they offer a $0 copay for Medicaid patients. The cycle of shame and isolation can be broken. Professional support is just a call or a click away.